Hello, my name is Michelle McAllister, and today is January 22nd, 2021, and these are my notes that we're going to use today. I would like to talk about the endocrine system. The reason that I picked this system is because working in cardiology, this is not something that we typically discuss or go into great detail, so I figure it's always a great opportunity to learn more. So I do know that the clinical specialty that treats endocrine disorders is technically an endocrinologist. I did read, though, that depending on the issue, endocrinologists have a wide background as far as education. It could be working in oncology, it could be a surgical endocrine surgeon, it could be ENT or even pediatrics, depending on the issue. So a specific organ I would like to discuss is the thyroid gland. Its anatomical location is going to be anterior to the surface of the trachea, inferior to the thyroid and cricoid cartilage of the larynx, and then it is medial to the jugular. 5 landmarks that are notable on the thyroid gland is that it looks like a butterfly shape. It's got those 2 lobes that are connected by that thin isthmus in the middle. Then there is thin connective tissue, a capsule that connects the unit to the trachea. And then there are blood sources. There are 2 major blood sources. The first is a pair of superior thyroid arteries. The second is a pair of inferior thyroid arteries. And that blood flow is what's going to give the thyroid gland that deep red color. The function of the thyroid gland cannot be understated. The more I researched it, the more I found out that it did. The thyroid gland produces the hormones thyroxine, calcitonin, and triiodothyronine, and these are all vital hormones that are produced. They have a specific role in the human metabolism, growth, and development of the human body, heart muscle function, as well as digestive, brain development, and bone maintenance. These are all incredibly important. Some of the hallmarks of what could go wrong if you have an injury to the thyroid include things like decreased concentration, depression, dry skin, and even weight gain, which I thought was absolutely fascinating that such a small gland could have such a huge impact on the body. Something else that I did find notable about the thyroid gland is that even though it is only 4 to 6 centimeters long, it's still one that you could feel if something were wrong. That inflammation is sometimes palpable, so you can go ahead and consult a physician. Thank you.